Interviews can be overwhelming. You have about 1 million different things to learn, so much to know, and you may not even have any idea where to get started. Well, in this video, we're going to be going over everything about the NHS and what you need to know to be able to talk about it well in your interviews so you can receive your 4 out of 4 medicine interview offers. We're going to be covering what the NHS is, what are their core principles, and the NHS Constitution document. So make sure you watch this so you're able to talk about it well in your interviews. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship, and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. Let's start off by taking a look at the 3 core principles of the NHS, as these are really important so you understand why the NHS was created in the first place. So the National Health Service has 3 reasons as to why it was created. First is to meet the demands of everyone. Second is that it's based on clinical need, not the ability to pay. And third is that it's free at the point of delivery. Now, this is really important to bear in mind because it essentially tells you how important the NHS is. It's designed so that everyone in the UK has access to free healthcare to support them, and that it's based on what clinical needs that they have, and not that those who can pay for more services to have access to more. It creates a sense of equality and distribution of resources so that everyone has access to resources that can support their health to lead to a better lifestyle quality. Now let's take a look at the 6 core values of the NHS. These values have been designed to ensure that the NHS has been created to help patients in the best way possible so that they can have the best quality of life. And if you're able to talk about this within your interviews, it shows that you are a good fit for the career of medicine and within the NHS too. Now, the first principle is working together for patients. Every single person who works within the NHS has to show that they have the teamwork and collaboration skills to work together so that all patients, by the end of it, they have a better form of quality of life, or that they have a better treatment and that they feel better because of all the professionals that have worked to support them. The second value is respect and dignity. This is so important to show respect towards every single patient and treat them all equally, but not just towards patients, but towards every single colleague and everyone who works within the NHS too. You should respect all your colleagues to show and respect that they have their knowledge in their different fields, and also be able to work with them again in a collaborative manner, because the more respect you hold for one another, the more better teamwork you will also have. The third core value is having a commitment to quality of care. Again, this is important because you should always be working to a high standard of care. Additionally, we'll also look at GMC guidelines which tell you what standard of care you should be working towards, and every patient should have access to high quality healthcare to support them on their healthcare journey. So if you are able to do as many things as possible to ensure that there is high safety, that every patient has good quality care, you should do so as much as possible so that every patient, again, they do have that better health outcome by the end of it. Fourth is compassion. You need to be able to show compassion to every single patient and show them that you care. This is really important in medicine, as I'm sure a lot of you will know from your work experience. Doctors have to show that empathetic nature so that they can help their patients. If a patient is ever distressed or experiencing extreme anxiety, being able to support them and console them is really important, not just in terms of their clinical need, but also their lifestyle. If there's things going on in their life that they're worried about, being able to support them and show that compassion. Additionally, also towards your colleagues, if they are ever struggling or going through something difficult, having that care towards them too is really important within the NHS. The fifth value is improving lives. Now, as I mentioned before, trying to improve the quality of everyone's life and doing the best for them as much as you can is really important. And this is the aim of the NHS, so that anyone who comes into the healthcare system, by the end of it, they are still able to do the things things that are important to them, or that you are in some way able to support them so that they have a good healthcare journey within the NHS. And the final core value within the NHS is that everyone counts. Every single person who comes into the NHS, whether it be a patient or a colleague, they are important, and you need to work together in an interconnected community. With patients, you should be working with them and not against them. And with your colleagues, everyone should feel valued and you should all help one another. It's about creating community, which is about support, helping one another, and helping your patients for the best healthcare outcomes. All 6 of these values are equally important as each other, and it's really important that you're actually able to talk about these and demonstrate them in the way you talk about yourself and your experiences in your medical school interviews. So now that you understand why the NHS was built in the first place and the core principles that it's founded upon, and that it's important for you to embody these, but also now we can go into looking at the structure of the NHS and how it's organised now. So the structure of the NHS can be quite complicated at times, and there is only a small amount that you do have to know about your medical school interviews. The first part of that you need to know is the idea of primary care. Now, primary care is the first port of call for a lot of medical services, and the most common example that people think of is GP services. Now, from a GP practice, either you have your diagnosis reached here, or you may have to be referred to secondary care. Now, secondary care refers to hospitals. Things like A&E is where patients may arrive if they're not coming through primary care. Within secondary care, again, patients will receive a little bit more specialist care, as there typically is more equipment in places like hospitals in comparison to GP services. And then the third stage is tertiary care services. What tertiary care services are highly specialized hospitals typically for a specific condition. So for example, there may be a hospital dedicated fully to neurological conditions. So if a patient is not able to be treated in a hospital in secondary care, and due to having a very specific or very niche type of disease or a condition, they may actually be referred to tertiary care, where he can get more specialist care because, again, access to more important or more specialist equipment that can actually help them with their condition. It's also important to mention that the NHS, it actually consists of lots of different organisations, and that their help is commissioned by the government and by the NHS. Now, as the NHS is free, typically the way that it's funded through the government is by using some amount of money from taxation, from national insurance, and a very small amount of money does come from any paid services such as prescription charges and things like that. Overall, this is what is used to help have organisations commissioned to work within the NHS, and overall this is what creates the NHS. Now we're going to talk about a document called the NHS Constitution. This is published and it talks about all of the key principles that every single healthcare professional who works within the NHS needs to show to all of the patients. A lot of these principles, as there are 7 included in here, are similar to the ones we've spoken about before, but again, it's important to show that you actually understand the NHS thoroughly and you can talk about these different principles. Now, the main idea of the 7 key principles that are mentioned within the NHS Constitution specifically is the idea of putting patients first, allowing them to be involved in their care, supporting them, having good teamwork, and always striving for that high quality care. The principles also talk about the idea of working together for patients, understanding that the NHS is actually constantly evolving. This is a really key idea, not just in NHS, but in medicine in general too, because there are always new developments, new changes that are happening, which could actually better support patients as well. So being involved in that constant evolution for the best quality of care is really important. And again, working together for patients, supporting them, working with them and not against them, and also basing decisions of clinical need and not of pay or who can pay a greater amount for different services. These are the ideas that are embodied within the NHS Constitution too, which I've summarised just now for you, so that you can actually talk about them in your interviews too, because you've been given this knowledge. In this video, we've looked at everything relating to the NHS that you need to know about. We've looked at the core principles, the core values, even done a summary of the NHS Constitution and the structure of the NHS too. This knowledge is really important so that you can use this in your medical school interviews now if you get a question for it, or just to show that you've done some extra reading. If you want to have a greater understanding into medicine interviews, like learning the ethical principles, learning different NHS hot topics, or just having a really strong understanding into medicine interviews so you can get your 4 out of 4 offers, make sure to check out the rest of my channel, as I have an interview detailing every part of the content that you need to know.